I thought it would be a good idea today to speak with an expert about the vaccination situation and what is recommended depending on what your situation is. To make some sense out of all of this, I'm happy to be joined by Dr. Catherine Hankins, professor of public and population health at McGill University, and also the co-chair of Canada's COVID-19 Immunity Task Force. Dr. Hankins, thank you very much for joining us today.
You're very welcome.
So, after all the government updates, the situation, obviously vaccinations are key in fighting this seventh wave, all the waves actually. First of all, let's start maybe with the third shot. What's the message there? The
message there, if you haven't had one, get it now. I checked and we're vaccinating about 11,000 people a day. That needs to go up because I looked at the statistics and we've got about, if you look at people 5 years of age and older in Quebec, we have about 33% that just got 2 doses and 3% just 1 dose and 9% none. So that's, we're looking at, 45% of the population that is underprotected because they don't have 3 doses. So get out and get that 3rd dose. Some people say that the primary series probably is not 2 doses. It's probably 3 doses anyway.
Okay.
So you're not, we're not using the term fully vaccinated anymore. We're using the term up to date in your vaccination because that will depend, too, on your age group. So there are people that have had 3 doses that are eligible for the 4th, and they should get their 4th as well. We see immunity wanes, both immunity from having had the infection and immunity from vaccination tends to wane. And we really need protection if we're going to avoid hospitalization and severe outcomes and death.
So let's talk about that 4th shot. Who should absolutely get it if they haven't gotten it already?
Yeah, I'm not too sure exactly what the recommendation is. The last I looked at was 60 and over here, but in Ontario, it's like 18 and over.
Okay.
If you've got other conditions, if you have high blood pressure or diabetes or any immune compromise, regardless of your age, you're eligible for that 4th shot. So now's the time to do it. Everybody thought, let's just wait when we get back together again in September at school and work, there'll be more transmission. We've got it now. We're in wave 7 now.
So I'll take myself as an example. So I'm 50 years old. I've had 3 shots, but my last shot was in January of this year.
Ooh, that's a long time ago.
Yeah. So would you be recommending, even though I'm not 60 plus, would you recommend I get that 4th shot?
I mean, I would recommend you get it. I just don't know if you can get it.
I'd have to check.
You're going to have to check to see because of your age, they may say you can wait. But if I were you, I would get it.
Okay, because in Ontario, I would be able to get it.
You would. Exactly.
Interesting.
Exactly.
And so there's a lot of talk right now about the fact that these shots aren't really adapted to these new variants that are causing all the havoc right now. And so what's your response to that?
Well, let's put it this way. We're not making any vaccines to variants we haven't seen. So we really do need a pan-coronavirus vaccine that's going to deal with not only what we've seen so far, but what's coming down the pike. The vaccines we have right now are working really well in terms of hospitalization, severe outcomes, and death against BA.4 and BA.5. The companies had come up with a bivalent, meaning a two strain vaccine that was BA.1 and the original strain. And we already know people, all of us know people who got BA.1 probably in December or January and reinfected, in May and June with BA.4 or 5. So I'm not sure. Let's see what they have coming down, but I would not expect it until probably end October. It's not going to be there at the start of the fall. So don't hold back thinking, I think I'll just wait till they got something better coming. If you're eligible, get what you need now.
No, I'm reading some texts from listeners, and they're saying, well, these were not shots that were designed for these variants, so I'll wait. So it's not a good idea to wait.
It's not a good idea to wait. These vaccines we have are working well against the severe outcomes. They're not good at working against infection, and that's why we're seeing so much transmission, both from people who've had a previous infection and people who've been vaccinated. And the problem with transmission, besides the fact that you can get ill and you can get long COVID and so on, is that it increases the chances for the virus to mutate yet again. So we really need to try to wear our masks in indoor spaces and be smart about not encouraging transmission.
There was a lot of confusion in Quebec, Dr. Hankins, about what and if you should get a shot, the third shot or the fourth shot, if you had COVID, and when, how much time you should wait if you had COVID. What's the thinking now on that?
Well, the general advice, if you check on what Quebec is recommending, is 3 months from your infection. I think it's probably best if you're at high risk. It's probably a good idea to consult with your care provider to see if you should be getting it before then. But certainly, having hybrid immunity, meaning you have had an infection and you're getting vaccination, is a good idea, but infection does not replace a dose, which was kind of what people were thinking. Oh, well, I got it. Doesn't that count for a dose? I wouldn't rely on that.
Okay. And my final question, doctor, is about this Moderna vaccine for children 6 months to 5 years. Your take on that?
Yeah, so we have to wait to see. It has to get approved through Health Canada. It has to go through the National Advisory and the Quebec Advisory committees on immunization. But it's worth getting. Okay. Many people have been waiting for it and hoping that it would come. The kids 6 months to 5 years don't have as severe outcomes as older children and older adults do. But they do have severe outcomes, some of them. And there have been deaths from COVID in that age group.
All right. Really appreciate your time. Thank you so much.
Thank you. Have a great evening.
You too. Dr. Catherine Hankins is professor of public and population health at McGill University, and she is also the co-chair of Canada's COVID-19 Immunity Task Force.